Today we are reacting to episode 5 of the PITT.
Another 2 of lorazepam.
For a total of 10.
Well, where?
He's still seizing.
This is the patient that was seizing in the waiting room earlier because they couldn't find room for him in the ER. You see how the doctor's holding him down to stop him from hurting himself? That's kind of what you want to do when a patient is seizing. You want to make sure they don't move around and hurt themselves. You want to watch out for the head so they're not slamming it on the floor. I wouldn't hold them down too much. You don't necessarily want to keep them still. You kind of still want to let them move around, but just make sure they don't hurt themselves while they're seizing.
Get some blankets on these side rails as a seizure precaution.
Yes, blankets on the side rail as a seizure precaution. Did you hear that? Normally, in a very stocked and well-funded ER, you would have what they call seizure pads that you could strap onto the side rails, again, so the patient doesn't move around and hurt themselves. Because when the rails are up and the patient starts seizing, they could start slamming their heads or their hands or their legs on the side rails and hurt themselves. If you don't have seizure pads, which often happens in ERs, what we do is we take a bunch of blankets and we tape it around the side rails and we kind of MacGyver our seizure pads. It happens all the time. I cannot tell you how many times I have taped blankets onto these side rails to make seizure pads. Sometimes I'll find one seizure pad and I'll have one seizure pad on one side and I'll have taped up blankets on the other side. It looks so bad, but it's effective. Those seizure pads, you only have like 2 for that entire ER normally, and you know, if someone's using it or they go missing, then you gotta do what you can with the blankets.
It's gonna hurt?
Oh, no. Skin's dead. You won't feel a thing. First time in Moab?
No. I belong to a club. Gears and Beers. We started riding the Frick Park during the pandemic. You know, just something to do to get out of the house. But we all stuck with it, and now we go on biking trips.
Oh!
Whoa! Do something, man!
Oh my god! Alright, so we have a blister that this student doctor cut open, obviously hit an artery. The only way the blood shoots out like that is if they hit an artery. And he had his mouth wide open and everything. Oh my god, that is gross. That has never happened to me, thank God.
What's up?
Arterial pumper under a blood blister.
Let's see.
Oh,
jeez!
Arterial pumper under a blood blister.
Can you fix it?
Oh, absolutely. First, we are going to put this BP cuff on to stop the bleeding.
Oh.
Forward. There we go.
Look at that. Look at that.
All right, keep the let go.
Yeah?
Mm-hmm.
Oh. She used the blood pressure cuff as a tourniquet to stop the blood from coming to that area and squirting out. That's pretty good. I've never done that. Used a blood pressure cuff as a tourniquet.
Thank you, Dr. King. Let's set up a suture tray with 3/0 nylon.
Okay. A pinprick and some burning.
Doc, can you step in here, please?
You got this, Whitaker.
Yeah, look at that. Happens a lot. Sometimes patients will come in and if they see a student doctor or a resident working on them, they will ask for an attending. They come in, they're like, hey man, like, I know you're a student or I know you're a resident. I'd rather have the attending work on me. Which sucks for the doctor in training, but sometimes that does happen. This motherfucker needs to get cleaned up. What is he doing here still? What is he still working on the patient for? There's blood all over his face and in his mouth. This is all kinds of wrong. You gotta get cleaned up.
Slowly letting down the cuff pressure until we can identify the exact spot.
I see it. Right there.
Okay. Now you can place a figure 8 suture.
He really needs to get his face cleaned up. This is so unprofessional to be walking around with blood all over your face, taking care of patients. Also, it's gross. Aren't you worried that there's gonna be some sort of infection or some sort of disgusting thing that you swallowed in his blood? Get cleaned up.
I've never done one of those before.
You should also never say in front of a patient, listen, I've never done this before, because that obviously will make the patient uncomfortable.
What did I miss in here?
I am so sorry. I just...
Made an excellent catch and saved Mr. Chasen's life.
Really?
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 There was a cut arteriole under a blottable vesicle. If Mr. Chasen had gone home without debridement, the blister could have eroded with uncontrollable hemorrhage.
Nice work. Jackson Pollock here might want to go hit the Scrubs Exchange.
Nice. Looking out for your fellow healthcare workers. I like it. But at the same time, should have suggested he go get cleaned up immediately.
Not if you're here for a medication abortion and you're past the mandated 11-week cutoff.
There can also be inter-operator variability.
I measured the gestational sac, 11.3, and the fibroidal diameter, 11.1. I didn't get a single measurement under 11 weeks.
So what are you saying, that Abbott lowballed his measurements to help a teen get the abortion that she wants?
Oh, so that's what she saw. The girl who's coming in for a medication abortion is actually over the time limit of when she's allowed to get an abortion. But the doctor said that she's not, so she can get the abortion. This doctor measured it again and realized that, oh, she's out of the range and is not allowed to get a medication abortion.
Falsifying medical records for Christy is flat out illegal.
She's 17. She deserves a life.
Of course she does. But I will not jeopardize my future in the process.
You'll be fine.
Someone finds out I falsified medical records, I'll get booted from the residency program. You've got tenure. Worst case, you have to take a job in Youngstown. The risks are not the same for you as they are for me.
You're right. I'll do it.
What?
Erase your history, physical, and impression from Christy's chart and be like you never saw the patient. I will take over. I will complete a new chart and upload my own image.
Robbie, I'm not asking you.
As you're
Shut
attending,
the
it is my
fuck
decision. I am a certified provider for
No, he's
mifepristone. You
not.
are not. And as a prudent physician, I should examine every patient before I order medication.
Okay, so this is interesting. As a healthcare provider, what would you do? A 17-year-old wants an abortion. It sounds like she's just outside of the range to get a medication abortion. And these doctors are willing to falsify medical records so she can get one. Oh my god! Interesting. Good drama. That would probably never happen. You are risking a lot if you do that as a medical provider. I guess he's willing to do that. So let's see what happens.
What happened?
I fell in the yard, hurt my arm. That's all.
Yo, we've been hugging this wall for almost an hour.
Relax, we're just gonna take her vitals.
See that? The EMT's complaining that a patient who walked in is getting attention when he's been hugging the wall for an hour. That's what happens. Paramedics and EMTs, when they bring patients into the ER and the ER is full, they also have to wait. You see, there's a line of EMTs and patients against the wall of the ER. Those are patients who called 911 and are coming to the ER, but there's no space in the ER, so they have to wait right outside. Usually, if the patient's stable enough, they can just drop them off in the waiting room. But if they're not, the EMTs and the medics also have to wait there with the patient until a room opens up. They're not allowed to leave the patient. What happens if EMTs and medics are lined up right here and they're busy and you call 911 and an ambulance can't come because there's not enough out there to help you? That's a bad situation, which is why we need to fix our hospitals and make more space or hire more people. Huh?
Poor Huckleberry. Not even 11:30 and you've already been demoted.
They only had morgue scrubs left.
She is such a bitch. Santos? God, can't stand this bitch.
It looks like you sustained a proximal humerus fracture
Ooh.
on the left upper arm.
Ooh.
There goes my backhand.
Alright, a broken humerus should be pretty painful. I don't know how this little lady is still joking around and chit-chatting like this.
The bad news is you do need to wear a sling for at least 6 weeks. And I have to insist absolutely no shoulder mobility for the first few weeks. And that means you're gonna have to step up even more, because on top of your usual ADLs, you're also gonna have to help your mom bathe, dress, and use the toilet.
ADLs is activities of daily living, which means she has to pretty much help her mom do everything. Now she also has to help her bathe and probably help her make food and eat, which is very stressful. Luckily for her, the mom is still able to walk around. It sounds like she's still lucid, which is nice. She does have schizophrenia, which kind of sucks, but for the most part, this is not the worst case scenario. I've seen daughters and sons who've had to take care of their moms and dads who are just completely out of it. They need full assistance getting up, walking, going to the bathroom, cleaning, going back to bed. Not too bad.
I'm so sorry, Mom. This would never have happened if I was more on top of things.
Any more on top, you'd be back in my womb. It's going to be fine.
And it's nice that the mom is also very understanding. This is a good situation. It's not too bad. I've seen a lot worse.
I know I can be a burden, but I like being in my own home. Just me and my girl.
You're not a burden. You're my mom.
That's another problem too. Some of these patients who get a little older, they love their independence and they will refuse to give it up. All they want to do is be at home. And sometimes when they come into the ER, we have to insist that they stay because they don't have assistance at home, and it could be very dangerous for them to go home and get injured again.
Don't worry. Things will be back to normal in a few weeks.
I'm not sure what normal is anymore. I can't even remember the last time I slept through the night. It's just... it's a lot.
Do you have any support at home?
I wish. It's just us.
You know, I hired a part-time aide for my sister to cover me when I was at work. It was really helpful.
It's out of our price range.
Yes.
I mean, I already work from home, and then there's the cooking and the cleaning and...
Extra aides and extra help to help with geriatric care can get very expensive.
You know, caretaker's fatigue is a real thing. You have to take care of yourself, otherwise you're gonna end up in here too.
Yeah, man. It happens all the time. People taking care of their older loved ones, sometimes they just burn out, and what they'll end up doing is leaving them in the ER and just taking off. It's called granny dumping, and it's a real thing. A lot of these patients who are older who come to the ER, sometimes we can't get a hold of their loved ones to pick them up or take them home or even come to the ER to check on them. They'll just leave them there because they know that the ER has the resources to help them and they can go take a break. It sucks for everybody, and the ER doesn't like it. So come pick up your grandmas.
Our computerized medical records have been glitching lately, and Dr. Collins' image didn't upload properly.
He's about to falsify
Okay, crown
medical
to rump.
records.
That's top of the head to the bottom of the butt is how you measure gestational age, and we are at 10 weeks and 6 days.
Liar!
I made it by 1 day.
I will order the medication. Dr. Collins will go over instructions on taking the pills when they come back from the pharmacy.
Damn.
Thank you so much, Dr.
Oh,
Albee.
I'm glad I could help. Even more glad to see you have such a supportive mom.
Well, he did it. He falsified the medical records. What would you do as a healthcare provider in this situation? If you can get away with it, of course you would help everybody. If you get caught doing this shit, oh my God, you're risking everything. He would never practice medicine again. That's bad. But it is a TV show, so it makes for good drama.
Had a tonsillectomy 10 days ago at St. Michael's. Started spitting blood about an hour ago. Good vitals.
Hey, Travis, I'm Dr. Robbie. How much blood?
A couple mouthfuls.
Can you open up for me?
Tonsillectomy, surgery to remove the tonsils.
Hey, Whitaker, Jesse. Got a post-tonsillectomy hemorrhage. Nebulize TXA quick as you can. Let's go, trauma 2. So this can go south pretty quickly. You up for it?
Yeah, so this kid looks like he had a tonsillectomy. He had a surgery to remove his tonsils, and now he's bleeding from the surgical site. Never good.
I've heard that load of bullshit before.
This guy again. Always complaining. I feel like he's gonna lash out and do something crazy soon. Like he's gonna start like hitting people. You know?
Took me all the way back there just to stick a goddamn thermometer in my mouth, you know.
Repeat vitals every 4 hours.
You see how the homeless frequent flyer knows that there needs to be repeat vitals every 4 hours? That's hilarious. This show picks up on all the little things that happens in the ER, which I really like.
Where's Teresa?
She went to park the car. Shouldn't have been more than 5 minutes.
Why don't you dial her number for me?
Did you pick up?
Straight to voicemail.
That's weird.
Yo. Sole caretaker, overwhelmed, exhausted.
I told her to take a break. You don't think she ditched her mom, do you?
I mean, it happens.
Oh no, she did it! She dumped her grandma at the ER. What the fuck? Oh, and just when I was talking so positively about these two, I guess we should have saw that coming. Granny dumping, people get overwhelmed, they stop by the ER, they say, here you go, your turn, take care of it. And we do.
No. He had the surgery at St. Michael's, but he's here now. No, he doesn't have a car. His parents are out of town.
Tonsillectomy kid.
Okay, well, how am I supposed to send him back to St. Michael's? We'll call him an Uber? You can't... That doesn't make... Hey, hello?
Probably shouldn't be having this awkward conversation in front of the patient.
Don't worry about it, though. I'll talk to my attendant.
Oh my
shit!
God.
I need a little help here!
How is this the second time someone has scored
Post-tonsillectomy
blood on this
hemorrhage.
kid?
Yank out and sponge it.
You stable, then it just opens.
Hold the blood bank, 2 units.
Shit.
Hold blood, get a second line.
Head and neck wouldn't come down to see him.
Assholes.
It's tacky to 120, his sats are down to 90%.
Okay, get a high flow nasal cannula, 100 of ketamine, set up the glide scope. Hold suction. I'm gonna try for direct pressure. If head and neck still won't come down, call Garcia.
This is a terrible situation, okay? Bleeding from that area of your body is almost impossible to fix. What we usually do for a bleed is we'll try to get in there and we'll stitch it up, but because it's so deep down his throat, like there's no way they're gonna go in there and stitch that while he's awake. So the best thing you wanna do is to intubate and stitch him while he's out. But the problem is, if you intubate him, now there's a tube in the way. There's no way you're gonna get to that cut. This is a terrible situation and has never happened in any ER I've worked at. So let's see what they do.
What happened?
A bleeder opened up.
Ketamine on board to intubate.
That's holding at 97.
Can you get an airway? Come on. Let's lie him down. Keep pressure on the scab. Nothing but blood. Can't see the cords.
Sats 94.
No.
Almost impossible to intubate this patient because they are bleeding directly out of that area where you're trying to get the intubation tube through. So what are they gonna do?
Open a crike tray and prep the neck.
They're gonna fucking crack.
Hold on. I'm going in blind with the bougie. I might be able to feel the tracheal rings.
And I might have a 3-way with Madonna. Move.
Not happening. Pressure.
Make room for the grown-ups.
Okay, hold on. We can try a retrograde intubation.
A what?
There's no obstruction. We just can't see what we're doing. So we take a needle and we put it in the cricothyroid. We run the guide wire up and out the mouth and we slide an ET tube up over the wire.
What did he
Never
say?
seen one before.
That's 90.
No time to play MacGyver.
What's he gonna do? What did he say? We're gonna try a retrograde intubation. What the fuck is a retrograde intubation? A retrograde intubation is a technique used in a difficult airway management where a guide wire is inserted through a puncture in the cricothyroid membrane, then used to guide an endotracheal tube into the trachea. Are you fucking kidding me?
Okay, I'm gonna give you a little slack so you can get past the pores. Yeah, I feel it at the trachea. 25 centimeters at the lips. That ought to do it. Pull the wire, bag him.
Balloons up. Yellow on CO2. That's good.
That is very good.
Shut the fuck
The breath
up!
sounds bilaterally.
Sats coming up. 90, 92.
Guess you're gonna have to save that scalpel for another day.
Yeah.
You guys got lucky.
No, we got skills, baby.
Ain't
we
no
got
way.
skills.
I'm crying. That's ridiculous.
Keep going.
Okay, so let me try to get this straight. A normal intubation is when they put a tube down the person's mouth, throat, and into the lung. They can't get the tube past the neck because of all the blood and the gauze that's trying to stop the bleeding. So what they did was they poked a hole here at the cricothyroid membrane, put a wire through, and they made it go through the mouth. So now the wire's in two places, throat and mouth. They stuck the tube down the patient's mouth using that wire that they stuck through the neck as a guide to get the tube down into the neck as they pulled that wire out. And now the tubes, that is, you can't, you're fucking kidding me. When does that happen? How did not happen? That is crazy! I mean, in what third world country did they practice this shit in to find out that this is possible? This is all still in the same day. All still in the same day.
Christy! What the hell are you doing here? Language. And I should be asking you the same thing.
Excuse me, who are you?
I'm her mom.
Mom? Aren't you her mom?
I can explain. No, that's my sister, Lynette. I am Christy's mother. Chris? Chris, baby, what are you doing here?
Oh.
I'm here for an abortion.
Did you do it already?
Oh no.
Okay, thank God.
Oh,
Okay, can we all just take a step back here?
Mom, I want this. This is my decision.
No, just listen to her. Okay, shut up.
Oh,
You have done enough.
no.
My daughter is a minor.
Oh, this is bad.
So she can't get this abortion without my say-so, right?
Oh, this is bad.
Is that right?
That's correct.
Oh no.
Then there is no way this is happening. Not now, not ever.
Oh no! Oh no! The drama! The drama! Oh my god, what if she finds out that Dr. Robbie falsified medical records to help her daughter get the abortion? This motherfucker is fucked. Got my heart going. Bump bump. That is some good TV. Well, thank you for watching. That is the end of episode 5. I will be moving on to episode 6 and beyond very soon. I am also currently on tour right now. Ticket links and dates are in my bio. Please come to a show. I hope to see you soon. Goodbye, motherfuckers.